Hello, I'm Dr. Dennis McKenna. As always, I'm joined by Dr. Fred Venditti, our hospital system general director. Today is Tuesday, March 9th, giving you the update from Albany Med. All right, Fred, let's pop open the graphs here.
Yeah.
Some great news. Here's the capital region. At one point, we had as many as 553, and we're just at 101.
I know. Just a tremendous change.
I think by Thursday, there's a good chance we're going to be under 100.
I think so, Dennis.
Very good. Next graph, admissions and discharges here to the medical center. This just basically shows you on any given day now, we're really in single digits. I think yesterday we had, was it 2?
Yes.
2 admissions to the hospital?
10 over the weekend, all 3 days combined.
Remarkable.
Yep.
And then the last graph here, which is the morning census here at the medical center. Currently we have 27 in the hospital, 15 on the floor, 12 in the ICU. Of those, 8 are on ventilators. But Fred, importantly, 12 of those patients no longer infectious.
That's right, Dennis. So waiting for their test to turn negative, as we talked about before.
So that means really at this point only 15 in the hospital that we're currently actively treating for COVID.
That's right, Dennis.
That's great.
And in the intensive care unit on the ventilated population,
Right.
many of those are trached patients.
Yes.
So they're making a slow recovery, but still on a ventilator.
And so, Fred, at this point, we talk about what tier we're at.
Yes.
And I think at this point, we're at lower levels as far as the tier levels.
Tier 1 for the ICU, and sort of between Tier 1 and Tier 2. Once we move all of our patients off of E3, we'll be at Tier 1 for Med-Surg, and we're almost there. We just have a handful left on E3.
Yesterday was an exciting day for us because visitors were allowed back on the campus in a more meaningful way. How did that go yesterday, Fred?
Dennis, it was fantastic. So we had 2 hours in the morning, 10 to 12, and 2 hours from 6 to 8 in the evening. Between the two-hour blocks, we had about 300 visitors come to see their loved ones. So that is so important to our patients.
I think I was telling you the story. I was off campus this morning for a little bit, came back on. As I was coming over the bridge, I bumped into a woman who was going to be visiting her sister, who's been in the hospital. She's been quite sick for 2.5 months. And this is the first time she's had an opportunity to see her. And she was so excited.
That's
and
tremendous.
Her sister was excited to see her. And so to everybody who made that possible, meaning opening this up in a safe way, we thank you. It's very important.
You know, Dennis, our average length of stay is about 6 days right now.
Right.
But there are a lot of people who are here for weeks because of the severity of their illness.
Right.
And they've been without visitors. So your point's an important one.
We mentioned yesterday was an important day. Today is an important day. Today is an important anniversary.
It is.
And so what is it, Fred?
So Dennis, 1 year ago today, we opened up Incident Command to deal with the COVID pandemic. You know, Dennis, this has been a tremendous effort on the part of a tremendous number of people in the organization, both leaders as well as staff at the front lines. You know, if you think back a year and what we've gone through,
Yes.
We've had over 3,000 patients show up and be COVID positive.
Yes.
About half of them admitted into the hospital. We've had to deal with all kinds of issues, negative pressure rooms, ventilators, therapies, supplies. You know, you can't begin to name all the things we've had to do and all the people who really dug deep to do that.
Yeah, maybe in this particular case, we're better off not naming anybody, but thanking everybody.
We don't have enough time on the video.
We don't have time. But sometimes Incident Command was 3 times a day, 7 days a week. It changed to twice, to once, back up and down.
Yes.
It evolved as the needs evolved.
And you know, Dennis, I would just finish by saying people really stepped up to handle this this really profound incident. Thank you.
I would take the opportunity to thank you in particular, Fred, for your efforts there, since you're right here with me. Let's talk about vaccines, some important numbers here. In the capital region, the 8 counties we talk about, so far, for people who have received the first dose of some vaccine, Fred, we're at 244,000 people, which is remarkable, right? Those who have completed the vaccine series, so 2 shots, if it's a 2-shot series, 120,000, so that's 11.1% have now completed the vaccine series.
And over 20% have received at least 1 shot.
Correct. And we do know there's going to be some news that's going to come out today about some changing with the guidelines. Let's wait till Thursday to talk more about that. We'll certainly update capitalregionvax.org, probably the best source you can go to for anything related to the vaccine in the region, and some great information this Thursday.
It's good website.
But we did learn a good news story about the medical students here on this campus and the way in which they're helping with the vaccine rollout. Fred, you want to give us some information about that?
That's right, Dennis. There's a clinic in the heart of the city here in Albany that Dr. Bob Pedlow runs. And our medical students have actually been volunteering at that clinic to administer the vaccine.
Yep, Dr. Bob is an incredible guy. He was a year or two behind me in medical school. I've known him for many, many years, runs a great clinic, and the fact that our medical students are down there with the vaccine effort is wonderful.
It really is. It's a tremendous effort on their part. It's really giving to the community.
So congratulations to our students and to Bob. Fred, what's the update on our efforts related to length of stay? I know that, obviously it's probably too premature to talk about whether or not the length of stay has changed, but is that still a focus for us?
It absolutely is, and popped up on the screen now is our current length of stay. Just to remind everyone, the top line, the dotted line, is the total length of stay, and the solid blue line is the length of stay of the non-COVID patients. So you can see there's quite a difference. So the COVID population still is contributing a fair bit to our length of stay. But we have opportunity, and we're beginning to focus on that opportunity to reduce our length of stay, which is good for patients as well as the hospital. Dr. Dan Pausé has constituted a group that's going to meet every 2 weeks to work on lots of little things to help drive down that length of stay.
So we'll keep at it. It's an
Absolutely.
important message.
It very much is.
Fred, we mentioned, I think last week, that it's Colorectal Cancer Awareness Month. However, today we want to talk about a different type of cancer, and there's some new guidelines that you're going to bring forward that talk about lung cancer.
That's right, Dennis. So lung cancer is the second leading cause of death for cancer in the United States.
Right.
And it's really tied to smoking. Smoking has obviously a very, very significant effect on the incidence of cancer. So the U.S. Preventative Services Task Force has released new recommendations on screening for lung cancer. And this is using low-dose CAT scans, so low-dose x-rays, to look for lesions before they present in symptomatic fashion. And so they put out new recommendations, it's the first time in 8 years, for smokers between the ages of 50 and 80 with at least a 20-pack year history of smoking. They ought to have an annual screening.
Okay, and the screening is at low dose?
Low dose,
CAT scan.
Low dose CAT scan. It's been around for a while. The evidence for this is very strong. So if you're a smoker and you fit that category, 50 to 80, and smoked for at least 20 years, a pack a day, talk to your primary care provider about getting screened.
And if that primary care provider thinks they meet criteria and orders that, is that the type of study that we can do here?
We can do it here, and it's also available widely in the community.
Excellent.
It's important. Screening is important, and as we come out of the COVID pandemic, we need to go back to doing things that are important for people's health, and this is something that falls into that category.
Great. I think this is the last category, Fred, is our DAISY Award winner.
Yes.
Once again, explain to everybody what the DAISY Award winner is.
So the DAISY Award is something that a family nominates a nurse for really compassionate care provided to a loved one. And so they submit that to us. We get many every month, and then a group decides which one really merits an award.
If you walk around the hospital, you'll often see nurses that have, if they've been nominated, they get a DAISY pin.
That's right.
And some of them, they look like a garden.
Right. That's
they have so many of them.
That's right.
But one is picked each month to be the winner, and this month it's Laura Garcia. And Fred, she's from D5 East, which obviously specializes in our neurosciences.
Neurosciences, that's right. And there's always something special that goes along with this,
that's
right, Dennis?
We talk about it all the time, the Cinnabons.
Cinnabons.
So hopefully one of these days we'll have them up here as well. So congratulations to Laura for her great work as well. So I think, Fred, we committed to coming back on Thursday with some updates specifically related to the guidance about vaccine, and I think there's some good news coming there as well.
That's great, Dennis. That's going to be great.
We'll be back again on Tuesday. We ask that you once again please take care of yourself, take care of each other, and we'll see you in 2 days.